The disease that I chose to research for this project is syphilis, and I think there's a lot of really interesting things about syphilis, mainly the later stages of the disease because they're much less talked about, and then also the impact that syphilis has had on our society as a whole. Syphilis is caused by the Treponema pallidum bacteria, and it is a sexually transmitted disease. This does mean you can't get it through casual contact. It can't be transmitted through things like hugging, kissing, sharing a toilet seat, sharing drinks, things like that. There's only two modes of transmission, either through direct contact with the syphilis sores or from mother to child. It does cross the placenta, so it can be transmitted directly through birth, and it can also be transmitted from parent to child through breastfeeding. Some of the symptoms of syphilis differ by stage. There's 3 to 4 stages depending on who you ask, but I've broken it down into the 4 stages, which includes latent and tertiary. Some sources do group them together. Primary syphilis is characterized by those sores, either in the oral, anal, genital regions, or all of the above. And these sores are usually pretty painless, so generally most people don't know that they have syphilis unless they get tested regularly, or they're experiencing some other discomfort from that. Primary and secondary syphilis are both very contagious, and primary syphilis typically develops about 3 weeks post-exposure, and then once it develops, it usually heals within 3 to 6 weeks. Secondary syphilis then appears about 2 months after exposure, so give or take 8 to 10 weeks, and then it's characterized by this sort of reddish-brown patchy rash, which you can see in this photo down here. So it then moves to latent syphilis if untreated, and this is usually called the hidden stage because at this point, most patients will no longer have any symptoms. This can last for years, and symptoms may or may not return after this stage. About 30 to 40% of untreated people will develop complications known as tertiary syphilis, and these problems can occur again many years after the initial infection. Symptoms at this stage are often characteristic of the affected system, and that can be anything from the brain and the nervous system, eyes, liver, heart and blood vessels, bones, joints. And if it does progress to brain and nervous system damage, it is usually referred to as neurosyphilis. So some symptoms of tertiary syphilis in the ear are going to be things like tinnitus, vertigo, hearing loss, and these things are usually sudden onset, just because once it progresses to this stage, syphilis does move pretty rapidly through the body. It can also affect the circulatory system by eating away at the heart valves and then causing swelling of other blood vessels or the aorta. And then when it comes to the eyes, it can cause pain, redness, vision changes, and blindness. And then in this photo up in the corner, you can see that this is syphilis affecting somebody's optic nerve. So this is tertiary syphilis that's just destroyed this person's optic nerve and thus their ability to see. Neurosyphilis is usually characterized by things like headache, confusion, trouble focusing, and then the symptoms that usually cause people to get checked out if they don't already know they have syphilis are going to be things like personality changes and symptoms mimicking dementia, because these are usually pretty scary when they occur kind of out of nowhere. It can also cause loss of bladder control and erectile dysfunction, and again, this is usually just because at this point it's done a number on the body, it's ravaged through most of the other systems, and it can cause things like stroke and paralysis, and the stroke is usually caused by eating away of those blood vessels and hemorrhaging into the brain. One of the things that I found in my research that I thought was really interesting is that syphilis can be detected in spinal fluid during all stages of syphilis, and about a little over a quarter of the cerebral spinal fluid that they tested from the patients in this study in the primary and secondary stages did contain the bacteria. And I just think this is kind of scary because it just shows you how fast syphilis moves. It's also important to note that after stages 1 and 2, syphilis is no longer curable. The bacteria can be eliminated, but the disease itself has progressed past the point of no return. About 15% of untreated cases will develop these severe progressive symptoms, and about 7 to 8% of asymptomatic neurosyphilis cases will develop these symptoms. Prevalence and prognosis. Syphilis has gone in and out of prevalence throughout history, and we did see a big resurgence in about 2018. This is due to quite a few different factors. A lot of these are the risk factors. If treated, most people will fully recover from syphilis, and the progression into the cerebrospinal fluid doesn't seem to affect people if they get treated early. Latent syphilis can still be treated, but again, that organ damage is generally pretty permanent after that point. Some of the risk factors for syphilis are going to be things like riskier sexual behavior, so having unprotected sex, sex with multiple partners, especially if those partners also have multiple partners, and living with HIV can put you at higher risk for syphilis, which is then a catch-22 because syphilis also increases your risk for getting HIV. One of the big things about syphilis is that a lot of the spread, transmission, and risk about it is just lack of proper healthcare, not having the knowledge of when to get tested, how often to get tested, not knowing that you need to get tested for syphilis, not knowing what the symptoms are, not knowing that you're at risk for it at all. And one of those things that can be a risk factor is being a homosexual male, simply because homosexual men do tend to both engage in riskier sex and have less access or more barriers to healthcare. With prevention and treatment, the most effective treatment for syphilis is going to be penicillin. There are other antibiotics like erythromycin and tetracyclines that work, but generally those alternative medications are only given in the case of allergy. Prevention for syphilis is the most effective treatment, and some prevention measures for syphilis are going to be abstinence or safer sex. Most people in this day and age are not abstinent, so practicing safe sex can be having safe partners, making sure you use condoms. Birth control is a great option, but it's not enough to prevent against STDs, so condoms are the next best option for that. Safer recreational practices, so being mindful of drug and alcohol use, especially in spaces you're unfamiliar with or people you're unfamiliar with. Avoiding douching can also help, because douching can be abrasive internally, and that can both push syphilis further into your system if you have those sores inside that you might not know about, or they can put you at higher risk because there's then micro tears internally. Also, breastfeeding with care if you are a parent who is breastfeeding a child, and getting proper health care, access to education, getting tested regularly. Testing recommendations vary a little bit. I believe the agreed upon literature right now states once a year if you're in a committed, healthy relationship that you trust your partner, once every 3 months in a new relationship, or if you're sleeping around. So any of those sorts of things, keep in mind. The impact that syphilis has had on our society is kind of insane in my opinion. Treatments existed for a really long time, and only one strain of syphilis exists in humans, which kind of by default means that we have extensive research done on this strain and thus the various stages of syphilis. One of the most notable examples of that is going to be the Tuskegee Syphilis Study, which I will talk about in just a second. But those cases increased by 80% in the US from 2018 to 2020, which I did mention briefly earlier, and syphilis remains the third most common sexually transmitted disease in the Western world. 3 of the factors that contribute to its prevalence are the continued prevalence and more positive attitude towards sex work, which is not a bad thing. It's just not everybody practices safe sex, so that does put sex workers at higher risk and thus their clients. And again, those risky sexual behaviors are really a big part of that. As society has become more sex positive, we also see less advocacy. As society becomes more sex positive, we also have to keep in mind that we need to be sex positive in a safe way and also advocate for safe sex. Additionally, the societal apathy and the bias towards STDs in general is a really big deal, because a lot of people who have these really severe symptoms don't want to get tested or treated because they're embarrassed. They don't want to admit they engaged in those risky behaviors because it might be frowned upon. They don't want to admit that something's happened with them and their partner. Any various number of things can contribute to people not wanting to get themselves tested, therefore contributing to the spread. So with more of those biases and barriers to care, one of the big things we see with that happened during the Tuskegee study, and in the article that I read, it described that these people suffering with syphilis were considered in the same category with the typhoid cancer. So they were really considered to be like the main source of scourge among society. There was also a lot of racial biases in this time, especially because at the time of the Tuskegee study, a lot of the patients available for study that had syphilis happened to be people of color, black people, people in less affluent communities. And then that then also gave them the barrier of the affordability of care, so most of the affected populations could not afford to be treated, let alone tested. And when it comes to late-stage neurosyphilis, autopsy is the best diagnostic tool, which makes neurosyphilis in and of itself hard to study because a lot of people don't want their loved ones degraded after death like that, especially to be exposed for having something like syphilis. So the Tuskegee Syphilis Study is a really interesting piece of history, and it happened between 1932 and 1972. So this study took place over about 40 years. They studied about 400 African American men with untreated syphilis. Thomas Parran worked with the Public Health Service and the Tuskegee Institute to do this study, and his main goal was clinical research on syphilis in the black community. He did recognize that there was a need for research and uniformity with treatment, and Parran, along with some anonymous philanthropist donations, created the American Social Hygiene Society. This is a little bit problematic because it really did focus on research of STDs in marginalized populations, but the problem, in my opinion, is with the name of it. I don't think that calling it the Social Hygiene Society gives people a lot of desire to want to participate in said studies. Some of the early focus on how contagious syphilis was, as well as transmission to the partners, more namely in the study they called them the innocent wives of the men who were being studied. There's a lot of problematic language and racial things that went into the way the study was carried out, and thus a lot of the things that we could have learned from the study were lost. In the 1930s, Parran found that about 80% of the population couldn't afford adequate care from private physicians at all, and so there became a major campaign for access, and this led to sort of a huge sweep for testing and treatment for STDs. And black people were originally scapegoated as the source for venereal diseases in America, which created a whole other host of issues because it was then sort of focused on that these white people couldn't possibly get it unless they were morally bankrupt and engaging in sex with black people. And this was one of those things that people believed that different races had different diseases and that they'd spread it between the diseases. And one of the pieces of language in the Tuskegee study that really irked me was the dirty Negro blood, because they were testing these black people, and of course if the only population you test is confirming your racial bias, you're gonna find your racial bias. And so syphilis' stealth became its hallmark for both people's refusal to discuss it openly and from its ability to lie dormant, because it can just sit in your body for years and do nothing, and then all of a sudden it can lead to symptoms that will kill you. And the pervasive silence about syphilis is what helps contribute to this lack of proper treatment, and I think calling people dirty and using racially loaded language in that deeply contributes, and continues to contribute to its high prevalence in the West, because even today we still consider people with STDs dirty in most societies. Thank you so much.